Hello, everybody. I'm Angela Duran, the Health Promotion Specialist here at Siouxland District Health Department. I'm going to be providing some disability and health statistics for you, and I'll also be covering some information regarding our All Abilities Health and Wellness Coalition, kind of what we've done, what we're continuing to do to help improve the health of people with disabilities. So I'd first off like to start by sharing some statistics. I am going to share my screen. According to the CDC, with data derived from the Behavioral Risk Factor Surveillance System, the BRFSS, 1 in 4 adults in Iowa, or about 23% of Iowans, have a disability. This is just slightly lower than the national average of 26%. And when comparing to the tri-state area, Nebraska comes in a little lower at 20%, and South Dakota is a little higher at 23%, but we're all still below that national average. And looking at county level data from the US Census Bureau Quick Facts, the percent of individuals under the age of 65 with a disability was pretty similar across the metro area. And this is kind of shown here in this middle upper graph. Dakota County came in at 8.8%, followed by Woodbury County at 8.7%, Union at 8.4%, and Plymouth was the lowest at 7.8%. And all actually are higher than their state averages. This differs from the stats in that first graph, mainly because the information for the county data was for those that are under the age of 65 versus the graph in the upper left is from the CDC is over the age of 18. So graph in the top right shows the percentage of disability types. This is consistent across the tri-state area, with mobility and cognition disability types being the highest. The next highest disability type is hearing impairment or deafness, followed by independent living, vision, and self-care. So why is it important to know this data? Because if you're not thinking about individuals with disabilities when you're providing services or doing your business planning or holding events, you really could be leaving out a significant portion of the population. It's also important to know that the data shows us that individuals who have disabilities are more likely to be obese, smoke, have diabetes, and heart disease than individuals without disabilities. And in fact, people with disabilities are 3 times more likely to have chronic health conditions. We think one of the contributing factors of this could be because nearly half of adults with disabilities don't get any type of aerobic physical activity. So for this reason, All Abilities Health and Wellness Coalition was formed. We started in 2015 and we're made up of many different organizations, advocates, and community partners in the area. We meet every other month here at the health department, and we focus on implementing policy, system, or environmental changes that aim to create a healthy, inclusive community by reducing barriers and increasing accessibility and providing physical activity opportunities for people with disabilities. Over the course of the last 7 years or so, we have been able to implement around 125 program, policy, or system or environmental changes within our community. And some of the examples of this is we have been able to remove barriers around the splash pad at Cone Park, and we were able to add double tubes for the winter sledding hill. We're able to add an adaptive climbing opportunity at Long Lines. And we've added sidewalk connections to park shelters and connected trails and parks. The one here in the upper right is located at the Miracle League and one of the most popularly rented park shelters in Sioux City. We're able to work with the city of Sergeant Bluff to add a sidewalk and an accessible park or bus shelter on Business 75. Just this year in February, we worked with the arena to add an all abilities division at a basketball tournament in February, where really athletes of various types of disabilities were able to play alongside individuals without disabilities. This was actually a very cool experience for all of those that were involved. We were able to bring beat baseball to the community, which is now available through the YMCA. If you aren't familiar with beat baseball, just Google it. It's a form of baseball where individuals play blindfolded, kind of leveling the playing field for those with or without disabilities. The images in the center bottom here are, we did a staff training development. So you have an individual who's batting blindfolded. The ball actually beeps. The blue stanchions here are actually bases. Those are the bases. They have a beeping mechanism as well. So the runner, after you bat, you run to the base and you have to touch the base before the fielders field it. And then this upper image is a few individuals who are trying to locate the white ball that's on the ground beeping using only their hearing. So yeah, if you haven't or are familiar with it, we encourage you to search that out. We also provide on-site assessments for businesses and organizations that are interested in ensuring individuals with disabilities can access their services, programs, and amenities. These really aren't ADA compliance checks by any means. They're simply an assessment that you use to provide feedback on things that you can do to make it safer and easier for people with disabilities to navigate around your facility or access the programs and services. It's a free service that's provided here by the Health Department and Simcoe. A couple of years ago, we completed an assessment at Four Seasons Health Club, and they completed many policy, system, and environmental changes, including adding a push button entry to their front doors, which is shown here in the image on the bottom right of the screen. They also added a card scanner. They put it on their front desk and they kind of pointed it down so that individuals who used wheelchairs or other mobility devices could easily access it. They added a non-slip surface in the pool, locker room areas. They added a new step, created a caregiver, comes free policy, and a lot more. Here at the Health Department, we're actually doing some similar things. So we're looking at our programs, our policies, our systems, and our environment. We're recently implemented a disability and health training for our employees and all new staff or new hires from here on out. We're going to be looking at adding some accommodation questions for individuals that are coming in for appointments. And we're creating a sensory friendly environment in one of our clinic rooms. We also completed a assessment at Plaza Bowl. So we are working with them to reduce barriers, and we'll be adding some adaptive equipment that will be making it easier for individuals with a variety of disabilities to be able to enjoy bowling at Plaza Bowl. In addition to that, we recently completed an on-site assessment with the warming shelter, and they're currently determining what environmental improvements they will be implementing. So if these are all things that you're interested in, or you want to learn more about what we're doing as a coalition, or you're interested in maybe having an assessment completed at your facility or in your organization, certainly just reach out to me, 279-6119, or you can go ahead and email me, drent@siouxlanddistricthealth.org. We also have some information and videos on our health department website on our disability and health page. So you can actually just enter that information, disability and health, into the search feature, and it'll bring you to that particular page. I thank you for your time today, and I look forward to hearing from you.